it must be a business imperative for what we do in the field of healthcare to integrate security and privacy and the policies and the frameworks that we all use. It's got to be just a part of your business. And if it's not, you're going to find out the hard way. You should have looked at it that way.
Welcome to the Risk Never Sleeps podcast, in which we discuss the people on the front lines protecting patient safety and delivering patient care. Today, I am pleased to be joined by my good friend, Carter Groome, CEO of First Health Advisory. Carter, good afternoon. How are you, sir?
Yeah, good afternoon. Thank you so much, Ed, for having me. I just love the format of this podcast and really glad to participate today. Thanks so much.
No, I really appreciate it. And I appreciate our partnership. We've recently announced that we're partnering together. So that's exciting. But we're going to stay on a different topic today. We're going to talk about you, Carter. How's that for exciting?
Look out.
All right. Well, let's start with tell us about your current role and your current organization.
But yeah, I am the CEO of First Health Advisory. And we are, and I think above all else, a digital health risk assurance firm. And we advise providers, retail health outlets, payers, life sciences organizations, government health entities in everything that they're doing across the digital health spectrum as it relates to privacy, security, business resilience, compliance, policy, and even probably above all that, governance.
Mm-hmm.
That's what we call risk assurance. And it's 100% focused on the health sector. And we believe all of those things that I shared must be considered a business imperative and really a condition of participation, in my view. And so we do a lot of board and leadership education and awareness and ensuring they feel informed and confident in their strategy on how their business will react and ultimately continue in the face of adversity. And so that's really what our firm is focused on.
So a pretty heavy lift, pretty a lot you're doing for organizations. When did you get started?
I've been in healthcare actually 3 days outside of undergrad. I drove back across the United States and I started my career with Adventist Health System.
Mm-hmm.
And it was really, my history is in electronic health records. And so there's a company that was the juggernaut of the day. They were the epic or Cerner of the day, called Shared Medical Systems. And anybody that's been in the business a long time has some roots in shared medical systems. I was implementing those systems in the early mid 90s. That was the start of my career. And I'm a lifer. I'm a healthcare IT lifer. There's no way I'm getting out now. I always dream of making tacos on a beach somewhere in the Caribbean, but
Overrated.
Overrated. Until that time, I'm somehow tied to this emotionally and physically. This is what I care about. It's what I wake up and it's my passion. It's what I do every day.
Mm-hmm. And when did you start your organization, your company?
First Health Advisory started in 2005. In fact, we incorporated in 2004.
Mm-hmm.
And so we're actually, just scratching almost 20 years.
Wow. Congratulations. That's huge.
Absolutely insane. I do consider myself in many ways an entrepreneur, but not a serial entrepreneur in that respect. But, it is a labor of love. You're sitting in the same seat that I'm in, and it is difficult for others to know all the challenges that we face in running a business because, oftentimes you're not doing necessarily the things that you got into the field for when you're running a business. But it is rewarding. And I think the work that we do overall in healthcare is super important.
And what helped you make that transition from EHR implementation to cybersecurity and risk management?
Yeah, I really enjoyed the years where we were focused on EHR implementation, integration, optimization. And it was a time when the systems were, more best of breed focused than ever,
Mhm.
where you have a specialty lab system, you have a specialty radiology system, you have a revenue cycle system, a CPOE, order system, and there was a lot of work to just integrate those systems and make sure they were efficient and how you got the information from those systems. And then meaningful use came, and sort of we all benefited from the
Mhm.
investment in meaningful use, and certainly we did. But I thought around that time, you know, th- that train that everybody's riding, that wave is going to come to an end. And I just actually, didn't absolutely love being one of 500 companies out there that did Epic and Cerner consulting work. We still do. It's a legacy. That's important work.
Mhm.
The informatics side of it is really important. The analytics side of it, in terms of what we're talking about today for AI, is so important. The information we're getting out of the EHR is important. But I just had a draw to security, to cyber, and I had a good
Mhm.
friend who's with the company now, Dr. Toby Gauker, who is the provost at the SANS Institute. I still think
Mhm.
SANS is the gold standard in education for cyber. And I sat down with him for breakfast one day and I said, Toby, I don't know security. What am I going to do? He convinced me that we had a great base of clients in healthcare. And he said, healthcare is the next target. Now, mind you, this is 2015 ish, late
Mm.
2015.
Yeah.
And Ruby was very prescient in saying healthcare is extremely vulnerable and you could help your clients with assuring risk and getting after some of their cyber concerns. And I said, I'll do it, Toby, if you join the organization. And here we are today, now almost 7, 8 years into that, and loving all of the challenges that come with running a risk assurance and cybersecurity firm.
Well, you had that vision to ask the question and then to act on it, which is it's so hard to do these days to take that leap of faith that
Oh,
if
believe me, it was scary. It's still scary today. Right? But I just love the challenge of it. There's always something to be learned in the
Mhm.
security field, and once you think you're an expert, something's going to
Yeah,
happen
that's
the next week that's going to make you not look like an expert. Uh,
exactly.
so that's
Yeah.
I really do enjoy it, even though it's a stressful field. There's no doubt. You're
Yeah.
living it. I'm living it.
Yeah.
It's
Yeah.
stressful.
Well, and you're uniquely qualified. That EHR implementation experience must give you that leg up on other providers in this industry as well.
Well, I think so, and it's also led us down this path of truly understanding the environment of care. Right? We talk cyber safety as patient safety, and if you're an organization that does not understand the workflow, that does not understand the impacts of certain security controls that you place on certain departments or certain assets or devices in the organization, how
Mm.
how informative is your advice going to be? And I understand there's a pure technical component to security, but there's an understanding of the operations of the business and what those that are leading those operations can and cannot do without technology that really helps us from a multidisciplinary perspective. And that's our approach, is looking at security as an enterprise issue. That I think is a differentiator in what we do.
Yeah, and again, leading edge, as we talk about integrating cybersecurity with the enterprise. Most people have thought about it as a silo to the enterprise. You must think about it horizontally these days.
Unequivocally. And that's where I come back to what I was talking about at the beginning, Ed. It must be a business imperative for what we do in the field of healthcare to integrate security and privacy and the policies and the frameworks that we all use. It's got to be just a part of your business. And if it's not, you're going to find out the hard way. You should have looked at it that way.
Yeah. What are some of the tips or techniques you could offer to organizations, listeners that may have been struggling with connecting the dots with the business?
I mean, we could go the framework route, we could go best practices route. Ed, I mean, I will say all day long. 405 day HICP, which you've done amazing work with. Look, the the advice, the counsel, the playbooks, they're out there. Right? And we look at NIST CSF, those are the two seminal documents, and they're codified, right?
Right.
PL 116321. OCR looks at those and says, well, if you've been following those practices, we're going to, give you a little slack if you've had a bad day. But I still think to this day, the most important thing is buy-in from the board, the leadership of the organizations are being run. If they don't have the imperative, as I talked about, to do these things, to make investments, and it's really hard. I get it. This is of the top 5 priorities in healthcare, and cybersecurity is one of them, at least according to all the data out there. This is the only priority that is not a revenue generating investment. And so it's a tough conversation, right? We in security just think, gosh, it's so idiotic of you not to invest in a program.
Right.
You're going to go and buy an MRI machine because that's going to return investment right away. That's a difficult conversation if you're a CFO, if you're a board leader. It makes all the sense in the world to us to invest, but they're looking at things differently, and you have to help them understand why it's important to do that and the risk that their organization faces if they just are blasé about cybersecurity. And it's a side thing. Let's just put a pizza at the door of the IT department and hope they protect us from a security standpoint. There's just every day. And this is why I get so impassioned and almost mad at what's happening here in Washington, or what is not happening in Washington. That every day people's lives and communities and healthcare organizations are a massive risk from ransomware. And the data is out there. This is impacting health outcomes. And so, your podcast here, when we talk patient safety, it's true. It's just a matter of getting that information out, bringing awareness to those leaders and those boards that this is the impact of what could happen to your organization. Do you care about that? I'm surprised every day that some don't really care. I don't know how else to.
Yeah,
but
I think that gap is closing. That gap is closing because a lot of folks have experienced the pain of going through a ransomware attack or a data breach or some other incident. And if you haven't, it's just now a matter of time. It will happen eventually.
Unequivocally. And that gap is closing. It's just, it moves so slow. And that's what's frustrating, right? You'd like to see more done. And we say here in Washington, Ed, progress has been made, but more can be done.
That's right.
It's so true. It's so true in what we do. And that's why I'm always advocating, and you're such a master at this, Ed, for awareness and education in our marketplace. That's, that will never go out of style to try to bring that message and educate different communities of interest in the problem and challenge that we're facing.
Right. Well said. Let's switch and talk about your culture. I've heard really good things about your organization. From your perspective, how do you define the culture?
It kind of starts with humility, Ed.
Yes.
And all of us need a little dose of humility, but it goes a long way, especially in our field of cybersecurity and privacy and risk. We're dealing with really important, really serious things. At the same time, a lot of people don't really understand, what we're doing. And so we can't bully people into, certain positions with our knowledge. I often, when I'm presenting to boards, or if I'm up on Capitol Hill talking to senators and congressmen, in a way, I'm talking to them at a fourth grade level to educate them. It's almost like I'm talking to my mom about what I do on a daily basis. But you've got to have an extreme amount of humility when you're doing that. And that is a part of our culture here. We are caregivers. All of us are, and we're serving the healthcare industry. And we have a large contingent of nurses and physicians on our team. And so we're very much a caregiving culture in a way, and that's how we have to treat our clients and ultimately those organizations and individuals that our clients serve.
Yeah, well put. That's what I love so much about serving healthcare is that there's a shared mission that you don't get in any other industry. And maybe if you do, it's not at this level within
Yeah.
healthcare.
Yeah. And
Um,
it's, I guess I'd add to that, right? The part of that mission, you can't just give it lip service, right? And I mean, you've got to live it, because people will, see that if you're just about
yeah,
making a dollar in this industry. There's people in healthcare that will see that very quickly. And so that's a hard balance. We're a business. We need to be profitable for sure.
yeah,
But you need to kind of put that somewhat in the back seat in terms of the organizations we serve, because their culture in many ways matches our culture. It has to be successful.
absolutely. Yeah. And you give your time back. I know you work on the private public partnerships as well. What do those mean to you and your organization? Things like Hiccup and HSCC.
Well, first of all, I can't say enough about what Health Sector Council has done in the last couple of years. I mean, it is amazing work, and it's amazing to see the individuals. I could go through all the names, but there's a lot of them. But how much they give of their time, and there's no dollars involved in this.
Right.
There's
Exactly.
not really a lot of notoriety that comes from, or going to be social media, influencers or superstars from this hard work. But it's meaningful, because I do think it is changing, the positioning in our ultimate sector resilience. And so I just can't say enough about that public-private partnership with Health Sector Coordinating Council, because there are certainly agencies that I think were in the dark if we went back even 5 years ago, and we were dealing with the same ransomware issues then. They've come so far, in terms of their understanding, their knowledge, their collaboration. They're working with CISA, they're working with HHS. White House has done some great things. You talk about the Hill. That's really the last mile in my mind, because you can have executive orders, you can do things at an agency level that will provide incentives or guidance, but statute's really the thing that ultimately moves organizations to do something. I stay away from the R word a little bit, but when we talk about a prioritized practice, I think, most of us in the security field understand what that means. It's like, hey, let's incentivize organizations to do the right things. And the playbooks are out there, like we talked about. But when I go up to the Hill, there's a genuine interest in it. I think there's a surprise in a way when I sit down in a congressional office or a certain senator's office and I show them the healthcare organizations and hospitals that have been hit with ransomware in their district or their state, and all of their constituents that have been impacted by it. There's genuine interest to help. And then you sort of get into the mix of everything else that's going on in Washington. Of course, we're still trying to figure out if we have a Congress, but um,
Awful.
it is. There's just not enough awareness outside of our own little bubble head.
Mhm.
And this is for me a personal mission to bring that awareness outside of the healthcare technology bubble to a national conversation. And so and you've done so good at this, the magazines Forbes or you know tier one media, you got a New York Times or Wall Street Journal. This is part of my mission in 2024 is to get that message out to the general public, because that's where we can really then move Congress to do something, because they'll start to feel the pressure from their constituents and not just a guy that's coming to lobby them and tell them this is something you should do. But I wish I could say I was a lot more optimistic about Congress doing something this year. And when you get into next year, an election year, it's going to be even more difficult to ask for dollars or incentives, whether it's workforce or meeting a baseline standard. So we might be looking at 26, 27. I don't know. And so the general feeling is we're sort of on our own in a way. And so we need to help each other as a community to be in a better posture from a sector perspective than where we are today.
That's right. Stronger together. So, yeah. And I think the community does such an amazing job of doing that. And the folks that do give up their time to move us forward on a number of different levels. It's just incredible to watch and participate in. And like you said, it's just it is humbling to watch the people that give up their time to continue to protect patient safety and care, which matters, especially, again, everyone's a patient, everyone knows a patient, everyone's related to a patient. It's our job to ensure that those patients aren't in harm's way.
Yeah, absolutely. I just say to put a cap on that, I am amazed every day because the individuals that have been a part of some of the health sector activities over the last couple of years, they're all super busy individuals with super stressful jobs, right? And yourself included, Ed. But to give the amount of time that it's required is amazing to see. And I'm appreciative of everybody that's been involved.
Yeah, and this is Cybersecurity Month, so we can't praise the efforts that these folks do enough, quite frankly. So as you think about this year and next year, what are your top 3 priorities for your organization? It is a problem, continuously a problem.
It's a huge problem, and your platform is an amazing platform, so I'll provide my support to that. But this is really the scary area of what we do. You can do all the things right? You can have the right program, follow the right frameworks, have all the right policies, but you're going to have a partner out there, that just for one reason or another, budget wise, just motivation wise, is just not doing the same things. And you can't understand if you have 4,000 business associates in your organization, you can't understand where everybody's posture sits. And so that's the scary sort of unknown blind spot that continues to haunt organizations today. And there's certainly a move from sort of email compromise to some of that sort of third party risk, because it just ends up being easier to get more by doing less if you're an adversary.
Right.
So I'm not telling you anything you don't know, but that is a major focal area of our organization from a services perspective, because there's a lot of work that goes into it. And with a platform like yours, it's fantastic because it helps you become more efficient in that work. But we've been for many years doing asset management work and understanding the risk related to assets, medical devices, IoT devices. That's another area that's just a ton of work. I'd say another area that we've spent a lot of time this year, and we're just trying to sort out the hype cycle elements of AI, but helping boards and helping leadership of healthcare entities sort of understand the promise that comes with that, but also the peril. And there's a lot of interest there. We sat on the sidelines for 5G and blockchain and some of that, but this is not something you can sit on the sidelines with, not with generative and predictive AI. And that's something, from a governance perspective, understanding sort of the privacy and intellectual property concerns, understanding accuracy concerns. And these are all really, really important for our organizations, our clients, to understand what they're getting into before it's too late.
It's moving so quickly too. It's scary. It's it's equivalent to I lived through the internet boom, and before you knew it was going to be a boom, right? So some people, believe it or not, they didn't believe it was going to be a boom back then. And AI is very similar, probably exponential in terms of its ability to impact us as a society. Yeah, it's incredible what's happening and what's happened over the last even 6 months as it relates to AI. So I'm glad you brought that up.
Proponent of the lily pad theory, right? And you could go kind of look that up, but we're sort of in, I guess, year in my view, kind of about 24, 25 of the little impact theory. But yeah, I've never seen, and I don't think many others have seen a technology rise sort of this quickly. Yes, we've used AI for a long time, Siri and these type of things, but
No, nothing like
it,
this.
its potential impact for healthcare is a use case supersedes, in my mind, any other sector. The financial sector, the retail sector, manufacturing, healthcare stands to benefit the most from this technology. And so understanding it from a privacy, a security, a risk assurance perspective is really, really important to us and to the clients that we serve. Um, and I'd say the last of the three, big things that are important to me is not necessarily a technology perspective, but what we were talking about earlier is getting that message in what's going on in our industry outside of the practitioners and the IT and the security leaders of our field out to the general public. If I can get to just a small part of that through one channel or another in the media, whether it be on TV or different national publications, I think that's a win because it does come back to putting pressure on our policymakers to do something, to provide incentives for our workforce, to provide incentives for just better overall security in our field. So that's another area where you'll see kind of a little elevation from our firm in terms of just that message sharing with those outside of our community.
Excellent, excellent. What keeps you up at night?
Yes, I do worry about, when we have clients out there, and something, happens, right? The third party, fourth party, et cetera, something happens, I in some way feel personally responsible if there is a bad day or if there isn't, so I worry about that a lot. It's just part and parcel to the field that we're in. We've chosen this line of business and there are inherent risks that come with it. And then at the same time, there's just so much geopolitical risk out there. There's so much fiscal pressure on healthcare. Sometimes I just worry, gosh, is it the right field overall? Like, but I think about just the people work for our organization that give so much to what they do and they care so much about the clients we serve. And I want to meet the moment as a leader for them and inspire them in a way, but also act and operate in a way that gives them, just confidence and gives them, I guess, pride of the organization that they're working for. So those are just the things I think about when I'm going to sleep, when I'm waking up in the morning, and I can't even tell you how many times I just wake up in the middle of the night, I had a dream or something, and it's mostly about work. I guess a function of how much.
Well, you don't have to worry that much. You have an amazing team, Carter. So I've met a few folks from your team. Everyone I've met is just continues to impress me. So you've really built a great company. What are you most personally or professionally proud of?
There was a moment at the beginning of the pandemic, Ed, and I think probably us sort of felt this way. Like it almost truly felt like the sky is falling.
Yeah.
It's like we're in healthcare and nobody knows what's real, what's not. And it was a really scary time. And, I was getting calls from clients saying, look, our balance sheets are upside down. The market, dropped 30%. We need to pause the work, Carter, that we do with you. We love you. We just need to pause. And that pause is going to be indefinite. And there was about a 2 to 3 week period where I fielded 15, 20 calls like that from clients. I mean, I was almost like I was afraid to answer the phone.
Yeah. Wow. Yeah.
And that was a really just personally a tough time thinking at the time I've spent 15 years of my life building this business and it could go away in a matter of 2-3 months. Honestly, I started thinking, what am I going to do? I mean, I don't know if I'll have a business if these calls continue to come in. And, through the course of the next couple of weeks, a couple things happened in a positive light. And as you know, some spending did pick up. And I'm really proud to kind of have stayed the course and not absolutely freaked out in front of my team during those times. But, I was there to say, look, we're going to figure a way through this. And we did get PPP funds as a company. And we used every dollar of those PPP funds to keep people employed that weren't working. They weren't able to bill hours because of what I just shared with you.
Yeah.
But we're able to get them, their paychecks. And that is, the bottom line that I'm most proud of.
That's excellent. Yeah, no, that was a tough period of time. I was getting ready to launch the company, going to HIMSS on Saturday, and then on Thursday they called the ball and just canceled everything. And I was like, same.
Well, I remember.
What am I gonna do now? The only other time I felt that was during the Silicon Valley Bank debacle, which I lived through as well, which was
all of us
challenging. Jeez,
for sure.
I know. We there must be an award for us somewhere out there. I'm sure. I'm just gonna hold
one day.
So outside of healthcare and your organization, what would you be doing? What are you most passionate of? You have hobbies or love for music or arts or theater?
I'm a father of an 11-year-old that plays a lot of soccer, and I love to go to games. So
Awesome.
that's a big part of our lives right now. I'm a husband. I'm actually talking to you from a rental home because our house is going through a complete renovation.
Oh, wow.
So you say risk never sleeps. Well, Carter rarely sleeps himself. Look, I love just hiking. I love biking, paddleboarding, anything outdoors. I was a swimmer growing up. I love running. Just anything outside makes me really happy. And then those on my team know, and this is, not many people know this, but I love to paint. Like it's just my escape. I don't do it too often because it takes time, but it's just always been a part of it. I just like art. And of course, music. I know you're a huge fan.
I am. Yeah.
Those things are the things that make me happy and allow
I
me. I
love that you paint. What's your? Do you have the painter that you go to, or
more sort of modern style, abstract type stuff.
Oh.
Yeah. So just
I would love to see some of your work, Carter.
Yeah. All right.
Yeah,
all right.
You're gonna have to. Do you have a personal website that you posted on, or
no?
I'd love to see some of your work.
I do that. There's an element, and this is sort of maybe is how I juxtapose the work that we do every day, and sometimes the feeling you don't make progress, even if you work really hard. You paint, you're making progress. And I grew up mowing lawns as a kid, right? Like you make tangible linear progress to how much work that you put in, which is almost completely opposite to our day jobs in cybersecurity. It's like
I
really
love that
to quantify the progress with the amount of work that you do.
So I similarly write poetry for that same reason, just to stay creative, but also to stay in that constant forward movement of mind and body and spirit. I love that. It's a great way to think about it. Yeah. All right. Well, one day I will see your paintings and maybe I'll buy one. All right. If you could go back in time, what would you tell your 20-year-old self, which was like last week for you, right, Carter?
First of all, this would be the obvious: is put every dollar you ever made into Apple stock, right?
I've been waiting for someone to say that. Thank you, guys.
I don't even know. It's got to be. Like, I don't. It's got to be. Over the last 30 years, the stock that has provided the most return. I don't know. Someone once said, put 10,000 in Apple in 1995 and you'd have $20 million or something. Yeah. So that would be the one thing. But I just treat people the way you want to be treated. You know, and not that I was any different back then. I had parents that were caregivers, a nurse and a doctor, right? So that's sort of was instilled in me from an early age in caring about people. And sometimes I think as a leader, right, a business leader, I mean, we could, share 1,000 stories of some leader that's just a complete jerk, right? And, has had a successful company. I say, gosh, do I need to be that way to be successful? Do you need to treat people like garbage? And it's just not, it's not who I am. And I know it's not who you are, Ed. And, in this field of healthcare, it's going to serve you very well to act and operate in that way. And so I think that's just stay the course and treat people the way you want to be treated, and good things will happen.
Yeah, I was told once that I would never be a CEO because I was too nice. Now, I'm sure there are other people that would say the opposite.
Yeah.
You're too hard, but
I get it. And it's like this media fascination, people are geniuses or whatever, but then you start to read books and talk about Apple too, right? That they weren't necessarily the nicest individuals in the world. And I just don't think I need to be that way.
Yeah, agree.
To be successful. Yeah.
Life is too short. All right. I would be remiss if I didn't ask you this question, because this is the Risk Never Sleeps podcast. I know you've prepared for this. What is the riskiest thing, Carter, you've ever done?
Every time I got behind the wheel when I was 16 years old, like you just every stoplight you come to, you want to race somebody. Like, so set that aside. There was a moment, a good friend of mine, we were in a canyon. There was a waterfall in the canyon. He got stuck, and in all seriousness, I hardly even talked about this. I jumped into a waterfall canyon, just threw all risk aside to save a life. And people thought I was absolutely insane to do that. But in the moment, I just didn't think about it. But then when I reflect on what I did, I just thought I could have easily, got caught up in, whatever my buddy was getting caught up, and, we saved his life. But it's probably one of the riskiest things I ever did without even thinking.
Wow.
It was instinct. But people do this every day. And it's not like they're thinking I'm going to be a hero. It's just they do things instinctively that, yes, put their bodies and their lives in harm's way to help and save others. And that's something that certainly comes to mind.
I hope you get a holiday card or a birthday card every year.
Oh, he's my best buddy in the world.
Yeah, it's awesome. What an awesome story.
Yeah.
Any last advice for those people that are thinking about breaking into cybersecurity, working in healthcare, or maybe that have a couple of years under their belt and they're looking for advancement?
Yeah, I mean, look, we all seen the numbers. The opportunity is immense. For people that want to work hard and be in this field, and we need as much help as possible. I mean, we talk about workforce just about every conversation we can have around the subject. And yes, there are incentives to go to other sectors financially, but if you share some of the same qualities that we've talked about on this podcast today, in healthcare and giving is important to you, I think this is a great field. It's extremely rewarding, and you can advance without a degree from MIT or some sort of superstar pedigree. And that's what I love about this field. I don't look at people and say, oh, they went to this school or that school, or they came from this. Are they doing good work? Do they know what they're doing? Are they talented individuals? And that's somewhat unique in some ways to cyber. And I love that. Right? It's you're rewarded based on what you know and your talent versus what school you went to or where you came from in some ways. And it's a leveling effect. And as such, I think there's just great opportunity in our field. And I want to encourage everybody and anybody, to take a look at those opportunities.
If you're on the fence, come join us. A lot of work, a lot of opportunity in healthcare and in cyber. And with that, thank you, Carter. I appreciate your time today. This is Ed Gaudet from the Risk Never Sleeps podcast. And if you are on the front lines protecting patient safety and care delivery, remember to stay vigilant because risk never sleeps.